Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Dr. Diana Driscoll. Dr. Driscoll is an internationally recognized authority on the autonomic nervous system and a pioneering voice in the treatment of postural orthostatic tachycardia syndrome, also known as POTS, and related chronic conditions. She earned her doctoral degree from the University of Houston College of Optometry and began her journey by studying idiopathic autonomic dysfunction through ophthalmic exams. Dr. Driscoll is the founder and clinical director of POTS Care, the only clinic dedicated to identifying and treating the underlying causes of POTS. She's also the president of Genetic Disease Investigators and owner of TJ Nutrition. Her research focuses on vagus nerve dysfunction, vascular endothelial health, idiopathic intracranial hypertension, connective tissue disorders, and post-COVID syndromes. She is the author of the Driscoll Theory, which challenged conventional views of chronic illness by exploring the roles of intracranial pressure, inflammation, and genetic traits in autonomic dysfunction. Her peer-reviewed work has appeared in the Journal of Vitreoretinal Disease, and she has served as the reviewer for several retinal journals. With 5 patents related to the autonomic nervous system, Dr. Driscoll continues to push boundaries in understanding and treating invisible illnesses. Thank you so much for being here today, Dr. Driscoll.
Thank you for having me, Mandy. It's really an honor, and I appreciate so much what you do to help share information. Patients such as you and I were there should not be in this position where we have to figure out things ourselves, but you're a great source of information. It's really valuable. Thank you.
Thank you. Yeah. And I look forward to having us both share a little bit today. So, we have both had the unique experience of being patient and provider now. So,
Yeah.
in light of how I usually start my shows, can you tell a little bit about your background and kind of how you got to where you are now?
Yes. And stop me if I'm talking too much because it was such a long journey. I'm an optometrist by education, was practicing and went to Costa Rica on a mission trip with our church. And we all got a virus. It was a bad virus. It was probably a SARS virus, but I was the only one who didn't recover. And within about 2 weeks, I started to develop symptoms like fast heart rate. When I stood up, my blood pressure was wonky. My neck started to bother me. I would get shaky. I'd have episodes where I got really hot and felt panicky. It was just everything was just breaking down. And ended up with the diagnosis of POTS, postural orthostatic tachycardia syndrome. And I thought, oh, praise God, I've got a diagnosis. Now they'll have a treatment plan, prognosis. They'll know what caused this, right? No clue. So 3 years into it, I was in clinical trials even with our major research hospital, and they had no ideas of what could cause it. And symptomatic treatment was doing nothing. I was completely disabled. And then my kids got sick, unrelated illnesses, unrelated triggers, and that's when I set up genetic disease investigators because I thought, what are the chances my kids could develop this? My husband at the time was fine. I was completely disabled, and there's no genetic component. So I thought I'll just start looking into it. And that's where what you mentioned, the ophthalmic studies, I started just by looking in the eyes because that's my comfort zone, right? And I thought people can't be this sick without something showing up somewhere. Doctors would tell me your blood work's fine, everything's fine. I knew it wasn't fine. I had to stop practice like that. My son was unable to go to school for over 3 years. So I was thrown into this kicking and screaming as a patient and started looking in the eyes for answers. And that wasn't the end of it, certainly, but that was the beginning of it.
Yeah. Yeah. So what was kind of that turning point for you that led you there and then really helped um, move you from that survival mode to actually healing?
And survival mode is right. The first 3 years or so, I had some functionality. It would come and go, but I was somewhat functional. I tried to change careers so it would accommodate, when I had to lay down and stuff. But then at about 3 or 3.5 years in, it just kept evolving. I just got worse and worse and worse. In some ways, that helped. because it made it more obvious about what was going on. So the first thing I figured out was I had high intracranial pressure inside the skull. And this was life-changing, and it went around the world. I put it out in the Driscoll Theory is one of the first things I found. It's been over 10 years when that was released. And it gets missed so easily because it doesn't usually show up on MRIs. As eye doctors, we look at the optic nerve inside the eye, and usually that looks okay. But response to treatment's dramatic, and that was hugely helpful. So that was one breakthrough. And I remember telling my neurologist, okay, I can survive. I think I have the hope to go on. Let me see if I can't just eke out some sort of life knowing this. And that worked for a couple of years. And then things got worse again because the underlying problem was still there. And the gut started to be real problematic. I ultimately just lost the ability to have bowel movements, like completely. Prior to that, it was constipation with episodic diarrhea. And I was excited to have diarrhea because it would relieve the constipation. I was told my gallbladder stopped working. And I took a pause on that because they wanted to remove it. I said, okay, if it was infected or, like an appendix, inflamed, it was going to blow or something, that would make sense to me. And they said, no, it looks fine. It's okay. Could the opening to the gallbladder be stuck closed, maybe? And that's kind of useless. It can't eject bile. And it said, no, the opening's fine. I said, okay, I want to think about this. People can survive without a gallbladder, but life is a little bit easier if you have one. We do have a reason for a gallbladder. And I said, this sounds neurological to me. I really want to see if it's neurological. Maybe I can figure this out and correct it. And I remember them being kind of pissed that I was walking away from that, but that was the correct thing to do. So the malabsorption syndrome that was occurring, the gallbladder dysfunction, the constipation, was just one aspect of a neurological state where the inflammation I was experiencing was blocking a neurotransmitter. And that neurotransmitter controls the vagus nerve, which you guys talk about a fair amount, that controls digestion, slowing the heart, all of those organs of digestion, bowel movements. And then it controls pupil size also. Patients tend to get more light sensitive or get drier eyes when this neurotransmitter is not working properly. And my pupils were big. I was very light sensitive. And then it's also the number one neurotransmitter used by the brain for short-term memory, some cognition. I'd certainly lost all of that. I was demented and then couldn't stay awake years into the illness. So I set to work on figuring that out. And first thing I did, hopefully this isn't too lengthy, was when I could not have a bowel movement, I went everywhere for help. I was in the emergency room. One doctor directed me to a surgeon. I ended up being checked for kidney stones. I had like this pain in my lower right-hand quadrant and said, could this be the ileocecal valve, the valve between the large and small intestine? Could it be stuck? And he thought that was interesting. But he was a kidney specialist. He checked me for kidney stones and said, there's no stones. I went, okay, great. And in his testing, he gave me some dye to drink so he could image everything. And that was just a divine intervention, I think, because 3 days later, after seeing him, oddly, I got a kidney stone. And I called him and I said, I know this is going to sound crazy. I understand you imaged me before. There was no kidney stone stuck in there. There is now. I've never had one before, but you're just doubled over, you can't miss these symptoms. He met me at the hospital. Yep, there's a stone. He removed it. And when I woke up from anesthesia, he said, Diana, you're right. I said, what? He said, it's your ileocecal valve. All of the dye we gave you to test you is still in you. It's just crammed up against that valve. It won't open. So long story short, I went home and thought, I'm on my own here. They don't know what to do. The surgeon said, no, no way I'm going to touch that. So I thought through what I learned in optometry school about the autonomic nervous system. And I thought, if this is a valve issue, it's triggered by movement of stool, which is controlled by the vagus nerve. I thought, if that nerve is damaged, which it could be, I was wondering if it was compressed at my neck, if something else had damaged it. It's very easy to damage it. So, do I have any way of hitting this neurologically? And I remembered in school learning there's two parts to that nerve. There's the long preganglionic nerve that goes from the brain into the organs, chest, abdomen, etc. And then there's a small synapse or gap, and there's a tiny postganglionic nerve. And I remembered the instructor in school saying the postganglionic nerve is so small, it's part of the organ itself. And why I remember these bizarre, details, my friends who were sitting right next to me, they have no idea what I was talking about. But I thought, okay, I have an opportunity. Let's try to stimulate that postganglionic nerve and thinking through the neurotransmitters and then the agonists or substitutes for them because they're not drugs. I realized nicotine is an agonist for acetylcholine at the side of the postganglionic vagus nerve. So I used a nicotine patch and put it on my abdomen to see if it would trigger it. And it did, by golly. I had a bowel movement and it had been 10 days, 11 days since I'd had one. The next day I used it again, worked like that next day. But nicotine is very inflammatory. And by the fourth day, I was purple red, hives. I knew I couldn't continue it. But I knew that all of the research to date on this was looking for an autoimmune condition that shut down these receptors because that's what it appears, right? And I was able to show very easily in my own body and then grab some other patients to help that our receptors were great. This wasn't an autoimmune condition, shutting those receptors down. I thought, okay, if I can't use nicotine, could I come up with some oral supplement that would trigger that nerve and respond in the same way? And then, even better, if this isn't a vagus nerve problem, if this is a neurotransmitter problem, it's also used by the eyes, the pupils, tear production, and brain. Could it cross the blood-brain barrier? Could it affect the receptors of the eye nerves? Those are different from the gut. They're not nicotinic. They don't respond to nicotine. And then other goals would be to work around the genetic disorders involving the production of that neurotransmitter. I'm very proud of that work. And ultimately came up with what's now Paracin Plus. So we've had that out, gosh, almost 10 years, but I was in my kitchen, making it for my kids and I long before that. And that was a big breakthrough. And then there were a couple more, but becomes more and more individualized as you work through the cases. Most of the commonalities that we found in POTS are in that book, The Driscoll Theory. I'm happy to give that book to anyone who wants a copy. Yeah.
Nice. So I'd heard of POTS before my own
Yeah.
accident, but in the
Mhm.
way I learned it, it was always more of a pediatric thing, and it didn't really show up in adults. But I'm learning now that that's very different.
Yeah.
And maybe we should kind of take a step back too, and for those that don't know what we're talking about, kind of talk about what is POTS and what does it look like,
Yes.
and then maybe we kind of add in. You've kind of, as you were talking about the vagus nerve, you kind of talked about where some of those things come from, but let's kind of cover that for a quick.
Okay. Let me chip away at this with your
Yeah.
guidance. POTS is postural orthostatic tachycardia syndrome, meaning when patients stand up, their heart rate increases. And whoever came up with this label assigned arbitrary criteria to its diagnosis. So generally, patients diagnosed with this are put on a tilt table and they measure the heart rate and blood pressure, and then they tip the patient up 70 degrees and measure it over 10 minutes. If the heart rate goes up more than 30 beats a minute, depending on the age, they're diagnosed with POTS. The problem is that POTS is not a disease, right? POTS is a presentation, like fever is a presentation. The illness is not fever. the illness is not the fast heart rate. We always make sure patients have their heart checked out. And I've got to tell you, it is extraordinarily rare to ever find someone who has a heart problem. And when that heart problem is corrected, they still have POTS. POTS is not a heart problem, which is unfortunate. That label still continues. So I don't know if you're aware of, Mandy, when someone, say, gets the flu, one of the diagnostic criteria is to look to see if the patient's heart rate increases. And when it does, they know it's pretty likely to be the flu. The heart reacts to certain aspects of inflammation. So in the patients we see with POTS, their heart is reacting to something. It's reacting appropriately to something. So what you don't want to do is just artificially slow down the heart. And then for whatever reason, um, doctors tend to treat this like it's a mild case of dehydration, which just kills me. And they'll give high salt, which is some of the worst things you can do for the cardiovascular system, beta blockers, which slow the heart artificially and cause horrible depression. And then we can't circulate the blood properly because our heart's going too slowly. Our blood tends to pool when we're patients. We need the tachycardia to maintain circulation. So the other dominoes that fall from that inflammation get ignored when the label is POTS. I told my doctors, ignore the heart rate. That's the least of my problem. I am sick from head to toe.
Mhm.
I think a lot of patients are diagnosed with, say, chronic fatigue syndrome. We see overlap with fibromyalgia, TBI, interestingly. And I researched PTSD, which is also an interesting thing because they tend to develop autonomic dysfunction. These are generally inflammatory patients. And the types of inflammation they're dealing with don't turn up on the traditional testing for inflammation. Like CRP, SID rate is almost always perfectly fine.
Mhm.
So as practitioners, we're taught if those numbers are normal, the patient doesn't have inflammation, and that's wrong. But we are still in the infancy of taking research into inflammation, chronic inflammation, and bringing it forward into practice. So patients are caught in that huge time gap where there has to be publications, things need to get into textbooks for medical schools, et cetera. And then doctors will take it forward. We as patients can't wait for that, right? I certainly couldn't wait. I couldn't wait for a new drug, to be developed. Like, no, we're on our own. Let's see what's out there that we can use right now. And if we know the methods of actions of certain supplements, medications, can we correct this problem? Yeah, in
Mhm.
each patient.
Yeah. Yeah.
Yeah.
So that tilt table you mentioned, I did that whole testing
I'm
as
so
part of
sorry.
part of
That's
mine.
brutal.
And as I was mentioning before we hit record, my findings were inconclusive. So I was not diagnosed with POTS. So that particular POTS specializing doctor didn't feel the need to take on my care because I didn't meet the criteria. He said, well, you can try some salt substitutes and some compression stockings, and
Yeah.
that should help.
Yeah,
Like, well,
that should
that's
do it.
okay, but my problem is that it wasn't just postural either. So I had dysautonomia at any given time. I could be sitting still and all of a sudden my heart rate would jump. And I'm like, what? So what is this?
Yes.
And had they
Yeah.
kept me on the monitor for another 10 minutes, they might have caught something because about 10 minutes later, that's when my symptoms kicked in. But I was at a conference recently and a really knowledgeable physical therapist was talking about all the dysautonomias and was saying that, even if you test negative on that tilt table for POTS, doesn't mean you have that you don't have dysautonomia. POTS is
Mhm.
just one of the dysautonomias. And when you
Yeah.
get there, there's a whole range of symptoms. But as you were mentioning, it's all kind of related back to that vagus nerve. So it's interesting to really put all of those things together because I think people think of the vagus nerve maybe from like the head up, but we don't often think about the fact that it does go all the way into the bowels and it can cause problems along that whole aspect there.
Yes. And what I did to get some more clarification on this is I sent out symptom checklists to uh, thousands or hundreds of patients with POTS, chronic fatigue syndrome, PTSD, and fibromyalgia. And tucked into those symptom checklists, I put the 35 or so symptoms of low acetylcholine or anticholinergic poisoning.
Mhm.
And the majority of patients showed the majority of those symptoms. They might be episodic, but it told me what we're dealing with is not a vagus nerve problem.
Mhm.
It's a neurotransmitter problem. So it was bigger than
Mhm.
the vagus nerve problem. The vagus nerve was certainly involved, but it was bigger than that. So we had a bigger nut to crack on that. But yeah, that's a huge, huge problem because other things develop from it. Like I said,
Yeah.
the malabsorption, the nutrient malabsorption for my son, the dementia, the whole bit. And there's true suffering.
Mhm.
Uh, this isn't a test that is like a blood test that we can do because the body breaks down acetylcholine like that. So doctors are trained, say in the ER, to recognize it based on the symptoms.
Mhm.
But as patients, like chronic fatigue, fibromyalgia, whatever, we don't go into the emergency room saying, well, my eyes are getting dry. I'm constipated, unless it gets really bad. We go in because we feel like we're dying.
Yeah.
Right. And we give them a laundry list of 80 symptoms, and then they just think psychiatric.
Mhm.
How could that person have so many, symptoms on so many different systems of the body? And those symptoms of low acetylcholine really have to be asked. Otherwise, the patients go, oh, yeah, that's happening too. Um, so there's so many problems with this from so many different directions. Trying to peel this all back and change diagnosis and protocol is quite the challenge, but it's my life's work.
Mhm.
Absolutely, because it's so sad. None of this should be happening, frankly.
Mhm. Mhm.
Yeah. And the worst thing is you probably experience, or one of the worst things, is the lack of validation for it, right? It's not like if we were diagnosed with cancer, as horrible as that would be, we'd have backing, we'd have a treatment plan, we'd have a prognosis, people would hold our hands through it. And you either pull out of it or you don't,
Mhm.
but we just flounder. I was in disability over 10 years, just floundering,
Mhm.
trying to figure it out. What a horrible position to be in.
Mhm.
And then the brain gets involved. Oxidation is a problem. We tend to get higher anxiety. We're very detail oriented, which isn't all bad, tend to be very high achievers. But that aspect of the illness is perceived by doctors of, oh, they're just more aware of their own body,
Mhm.
which just couldn't be further from the truth. So it just breaks my heart. Yeah.
Yeah. Yeah. So what advice do you have for anyone listening that might be a patient who, or anybody that knows somebody that has been dismissed or misunderstood by the medical system?
One, you have to know this is real. This is bad. I mentioned to you, I set up a YouTube when I was a patient called Pretty Ill. And I just wanted people to know that. We didn't know what this was, but I wanted to reassure the people that this is real. It isn't a psychiatric condition. They're not making it up. They need to be believed. Um, and if you have anyone, if you're a patient, anyone who can support you in that and just believe you, they may not have the answers for you. You need that just for your own psyche, right? Not everybody has that. We set up a Patreon account called POTS Rebels, where we offer support, we share information. There's a ton of education on there. We have a meeting next week actually to talk about family dynamics. How do you deal with that? Because it is so brutal. Yeah. But know that there is always a way out of it. Always. I've never seen a case where we go, oh, no idea on this one. That's a stopper. Yeah, we can pick it apart. And we start with the commonalities. And we're at potscare.com. We start with the commonalities among people, like the propensity to develop high intracranial pressure, the propensity for the neurology to be affected and develop malabsorption, et cetera, the brain health, which is critical, and then the cardiovascular system is affected by this inflammation. How bad is it? What has it done? And how can we nurse that back to health to get those blood vessels healthy again? And then we look at, okay, what is the difference among each patient and also explore that. So they're tough patients, I will
Mhm.
say, but I love a medical puzzle. I really I love because that's all I did, for many years. And so potscare.com is a source of some information. I hope it helps. There's a package too I put on there. If the idea of inflammatory POTS is just this new idea to somebody, it talks them through inflammatory POTS. It has supplements. There's an app on there, and it goes for about 3 months, where I talk people through this. I think word is getting out. Praise God. I think COVID helped a little bit with that. Also wonderful, but it's still painfully slow to watch the progress.
Mhm.
So I'm pushing things along as quick as I can. My number one piece of advice is never give up. There are always answers, and someone may not have their answers today. They may not have them tomorrow, but there are answers always.
Mhm. Mhm. Yeah, I push that a lot too. I tell people if you're not getting the answers that you want, go find another provider because somebody's got the answers for you. You just haven't found the right person yet.
Yeah, it's tough. I would say at least half of the patients we see at Potscare admitted to trying to commit suicide at some
Mm.
point because you're just so sick. It felt like my brain and body was on fire sometimes. No one was helping. We had no answers. It's completely disabled. And that's not atypical.
Mhm.
Yeah. And then if you throw in the lack of validation, lack of hope, what's the point, right? Completely understand that. This should not be happening to patients.
Yeah.
So we're here to change it.
Yeah, those symptoms can be so disabling, and I think
They
that's
are.
that's one of the things that I've seen with patients as I'm getting back into care and building a concussion program myself. That a lot of
Yeah.
people are affected by this dysautonomia, and
Yes.
just seeing how much it affects their day-to-day life and disables them from the activities that they want to do. Knowing that there are options and ways that we can actually treat it rather than just putting a band-aid on it, it's really
No,
comforting.
absolutely. While you're working through this, I hate to sound like a salesman, but because this is patented, I think I still want to stress it. If someone leans toward constipation, they lean toward fast heart rate, maybe light sensitivity, Paracin Plus should fix it, whoop, like that. And then the organs respond, awesome. And then NAC Max for that oxidation that drives that anxiety response. I don't know that I could have recovered without it. That you don't have to know what type of inflammation you're dealing with to at least restore the neurology and control the oxidation.
Mhm.
So some things we can do while we're working through the rest of it that give people hope to go on. Yeah.
Yeah. Yeah.
Mm.
Yeah. So do you have any upcoming events or any projects you'd like to share with our listeners?
I'm probably most excited, we just completed one about the Patreon account,
Mm.
patreon.com Pots Rebels. And the meetings that I have with them are just so rewarding. I just love this and really feel like we're helping people. And I'm trying to put all of the information I can onto that account. So that we always have research going on at genetic disease. What I was able to learn about the autonomic nervous system, I paused and looked at what about people who don't have PODS? But let's turn it down some, like chronic dry eyes, for example. Could they be dealing with some sort of systemic inflammation that affects tear production and pupil size? And the answer is yes. Okay. So kind of mainstream some of that. I don't think, as you know, that you have to have a diagnosis of PODS to be struggling with autonomic nervous system. And we already have some answers for that. So that and brain health is also one of my um, focuses of study that we're really looking forward to releasing more information. Oh, and I should mention, at some point, we're going to get out more information on hypermobility or Ehlers-Danlos syndrome. There is a reason these people overlap, and it isn't structural. That is not the reason, and this should be brought forward. So Patreon is where we'll be putting all that information.
Very cool. Yeah, I've seen those two connected quite a bit. So, uh,
Yeah, again, reasons for that,
yeah.
right? Yeah.
Indeed, indeed.
Uh-huh.
So you mentioned a couple places people can find you, and I'll include those in the show notes as well. Kind of as we wrap up today, is there any last little bits of words of wisdom you'd like to share with our listeners?
I wanted to thank you for what you do. And I know the struggle is you're able to work, which is wonderful. That is so important for self-esteem and to be able to help other people. But to thank you for giving that the effort that you do, because I know how hard that is when you're not 100%, but I'm sure you're helping others. We shouldn't, as patients, have ever been put in the position to have to figure out our own illness. But that is what's happened. So I'm on a mission to share as much as possible, just get it out there. And I know you're helping to amplify that. So thank you.
Thank you. Yep,
Mhm.
that is the goal, to try to disseminate this information so that
Yeah,
people can find it easier and don't have to
that's
search
right.
so hard. So that hopefully in the end we will all be better providers for it.
That's
So
exactly right. Yeah. It'd be nice if we didn't have to get sick first. But,
that would have been
oh,
really
well.
nice.
And everybody should know I don't have POTS. I haven't had POTS for years. I don't ever plan to get it again. My kids no longer are sick. Everybody's fine, but we know exactly what happened and we
Yeah.
can maintain our health. So POTS and these associated conditions are not forever. It
Mm,
can feel like it sometimes when you're still looking for answers, but there's ways out.
mm. Very cool. Very cool. Thank you so much for being here today, Dr. Driscoll.
Thank you, Mandy. It was really an honor. Appreciate it.
Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.